I'll be speaking on myopic defocus glasses, and there are three varieties. And this morning I learned that Dr. Chavan has another one, new one, and there are four varieties of myopic defocus glasses now in the market. So we all know that there are these two theories of development and progression of myopia, which is a cumulative lag and peripheral hyperopic defocus. I will not go into all the details because it has been discussed earlier by two speakers. So the possible mechanism, they say, is that hyperopic defocus will induce a cascade of cellular and biomedical changes, mechanical changes in the retina and the choroid, which leads to collagen decrease and remodeling of the sclera such that the sclera stretches and elongates, producing myopia or growth in axial length. So how do you treat that? How do you prevent hyperopic defocus? And the simple answer is to create a myopic defocus. So one of the lenses which is in the market is DIMS, which stands for defocused multiple segments, which are present in these lenses. And these lenses are manufactured by Hoya, and the trade name is Myosmart. And they create what is known as a simultaneous defocus. We'll learn a little bit more about this simultaneous defocus a little later on. The spectral glasses look like this on the right-hand side, and there is a central zone of 9 millimeters for distance refractive correction. And surrounding this are about 400 multiple defocus segments, each of which has plus 3.5 diopters in it, so that it produces a myopic defocus of 3.5 diopters. Now what happens is that through the center one sees clear vision. Myopic correction is done just like in a single vision glass, but when the light rays are refracted through the lens slits, it produces a peripheral myopic defocus. And that is the reason why this is said to create a simultaneous defocus, which means good central vision and a peripheral myopic defocus. The other glasses are known as HALT glasses from Essilor, and the trade name is Stellis. They have been introduced in the Indian market too, and HALT stands for highly aspheric lenslet targets. So here you have a central area for myopic correction, and surrounding this central area there are 11 rings of myopic defocus lens slits, each of plus 3.5 diopters. Now what they do here is that instead of one plane of myopic defocus, the geometry of these concentric rings is such that all the rays that pass through them are deviated non-linearly, so that a fuzzy diffuse area in three-dimensional space is formed in front of the retina. So that's why they call it volume myopic defocus. There's a three-dimensional volume of defocus in front of the retina. And when you look at, compare the results of these two lenses, and you look at the spherical equivalent refraction, DIMS scores over the HALT glasses. But when you look at the axial length progression, there is not much difference between the two. There is a 66% slow progression as compared to single vision glasses for DIMS, and about 64% for the HALT glasses, and they are more or less similar. Now the new one is the Kubota vision glasses, which produce an active myopic defocus through augmented reality. So this is the new one, very expensive pair of glasses, and the proof of concept study was presented by Kubota Vision in 2020, and now they have come up with commercial version of their glasses, and only available now in Japan and the US market. So these are very unusual in that there is a central 15-degree zone from which the myopic refraction can be done, and all around the rim are these white micro LEDs. So they project white light on a ring of micro lenses, which produce a 3.5 diopter myopic defocus within the eye in the pattern you can see on the right hand side over there. So that is the kind of pattern you will see, the patient will see within the eye, And there are certain advantages to this. Because you are using LED lights which can be programmed, there are advantages to using this glass. And what are those advantages? Is that the defocus that you're producing can be programmed. So specific areas of the visual field can be stimulated. For instance, you program it to stimulate only the superior hemifield or a particular other region of the field. So that can be done with these glasses. And we also note that there is diurnal variation in the axial length and the choroidal thickness. Now, these glasses can be customized to work only in those time frames where you expect the diurnal variation in axial length and choroidal thickness to be maximum, and then they will complement the effect of the daily diurnal variations in these two parameters. Also, the luminosity can be controlled because there are LED lights which are producing the defocus. So you can control it to mimic bright outdoor lights. We know that outdoor sunlight is very important for retarding myopia progression. So you can have a very bright myopic defocus also with this glass. You can reduce the intensity if you like. Then you can chromatically tailor the LEDs to produce violet light too, or a little bit of violet light, because violet light, as we have discussed earlier, is important in preventing progression of myopia. And there's no distortion of the visual field from the projected defocus. So this is the Kubota glass. Now, when you look at the results and compare it with DIMS and the Essilor Stellest, you can see on top over there that so far as spherical equivalent refraction is concerned, it is 148% more effective than single vision lenses as compared to 69% and 65% with Hoya and Essilor Stellest. Coming down at the bottom of the table, when you look at the axial length reduction, then this is 91% as compared to 66% and 64% with the other previous two lenses that we have discussed. So probably this is the best one available in the market, but it is very expensive. Now, coming to choosing the lens, India is a developing country and one has to choose very appropriate lens for the right setting, because most of the patients that we have in our clinics are poor or middle class. So you have to be really careful in which ones you prescribe bifocals or atropine and which ones you can prescribe these expensive Stellest lens or Mio Smart lenses. So choose at your discretion which one you want to. And thank you so much for your attention.